Hello, this is John Kanellopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center. We're going to travel through the postoperative management of a young lady, 30-year-old lady today. We had treated her left eye in the past. Her right eye was treated early this year, 2025. We can see that her keratoconus is probably stage 2, 54 steepest, thinnest cornea 462. Significant visual problems. She's almost at 20/40 uncorrected, best corrected 20/50. This is her today. She sees without correction 20/30 and with correction reaches at 20/25. We're almost 2 months. I think tomorrow is her 2-month anniversary after her Athens Protocol CXL. And this is the difference. And this is where we always want to focus. And we always want to emphasize why is it that the difference really underlines the importance of our protocol. We can see that the steepest part of the cornea is flattened over 6 diopters, and the flatter part of the cornea up here has steepened 4 diopters. So we have an over 10 diopter differential that we can see here. The flattened superior nasal area, steepened inferior temporal area. We can see this normalization and how robust it is with a combination of a topography-guided normalization therapeutic ablation combined with CXL. So, and our next step here is to look, of course, as I showed you before, the surface is still needs to heal a little bit more. We're discontinuing the low parallel Lotamax commercially to improve the surface, and we of course employ corticosteroids to avoid scarring. We can see the ground glass appearance that really underlines the cross-linking in the fresher cross-linked right eye. Left eye has been almost a year. You can barely tell it's cross-linked. I can kind of tell by the way the cornea stroma appears here. It has a very slight ground glass appearance. Not sure if it can be visualized that well here, but if we look at our OCT maps, we can see a lot of information here with the Vanti OCT. We can see that the ocular surface is still healing. It's blue. Once we stop the corticosteroid and a few months go by, it's all going to turn green. But the key thing here, and we reported this, is that the thinnest part of the cornea, the epithelium is almost normal. So this is a evidence in our clinical experience of stability of the cornea, along with the deep, very deep and very broad cross-linking line. We're over 60% depth in the cross-linking. And this again is 2 months out in a 30-year-old young lady here in Athens, Greece. And we're gonna jump into a 4-month post-op on a young gentleman. And again, in this gentleman, again, it's the right eye. We're gonna look at the OCT images, and we're now 4 months out, and it kind of underlines what I mentioned before. The epithelium is almost normal here. We can see that the thinnest part of the cornea does not really flag significantly as epithelial remodeling here. A very deep and broad cross-linking line still visualized. I can also tell how irregular the cornea was by the fact that the posterior cornea surface has remained very irregular. The anterior has been normalized because our topography can treat just the surface. And if we look at the preoperative epithelial map, which shows in our clinical experience significant active keratoconus here and the significant epithelial remodeling. He doesn't wear a contact lens, and this is just from eye rubbing, so obviously he sleeps on his right eye. And this is him today, and we can all appreciate how drastically the epithelial remodeling has changed, and also a sign of stability. But the proof in the pudding is how the cornea shape has changed, and this is the pre-op total cornea with a Pentacam. The post-op, again, of course, this is at a cost of cornea thickness. It's not, the thickness is always underestimated post-operative cross-linking. And it is when we look at the difference map that underlines the great, robust improvement achieved with the Athens Protocol cross-linking. We have a 11.2 diopter flattening at the cone area and a 1.5 diopter steepening at the superior area that had flattened. So this is almost 14 diopters of normalization of the cornea. And he again went from an uncorrected of 2100 to an uncorrected of almost 20/25. Of course, with minus 1.5 of myopia, he improves to 20/20, and we'll wait a little bit more for this to stabilize. This particular case, if 1 or 2 years went by and it was stable, his refraction was stable, that is, we could attempt to correct that with a PRK and maybe treat a little bit of the cylinder, taking that all the parameters and mainly the epithelial mass would be stable. So little run by on what are the clinical signs that we look at in our post-Athens protocol keratoconic patients. We can see here 4 months out, and it's very hard to tell that something has happened in this cornea. Hope you found this presentation interesting. This is John Kanellopoulos signing out. Thanks so much.